Imagine waking up tomorrow morning. The house is quiet, you stretch out in bed, and for the first time in years, your body responds exactly the way it did when you were in your 20s. No hesitation, no mental gymnastics, and absolutely no blue pills hidden in your nightstand. For most men over 50, that morning vitality feels like a closed chapter. But what if I told you the secret to restoring that automatic, effortless firmness isn't in a pharmacy, but literally in your own hands? It is not about your age. It is about a mechanical failure in your circulation. Today, I'm going to show you a 60-second mechanical massage targeting one invisible spot on your body that reboots your pelvic circulation instantly. I am Dr. Anya. I am going to teach you how to flip the biological switch back on without risky procedures in complete privacy starting tonight. Let's get to work. Before we talk about the solution, I need to completely change how you view your own body. If you have been struggling with a lack of morning firmness or fading stamina, I want you to hear this loud and clear. You are not broken. Your masculinity has not expired. What you are experiencing is not a failure of your manhood. It is simply a predictable, mechanical failure of your local plumbing and wiring. Think of your pelvic region as a highly sophisticated, high-performance engine. For that engine to roar to life automatically, like it did in your 20s, 3 completely different biological systems must communicate with flawless precision. First, you have your command center. Your brain must send instantaneous electrical arousal signals down through your spinal cord and directly into your pelvic nerves. Second, you have the supply line. Your blood vessels must be flexible enough to instantly dilate, allowing a massive pressurized rush of blood to flood the area. And third, you have the structural foundation. Your pelvic floor muscles must act like a tight, highly responsive valve, clamping down to trap that blood and maintain total firmness over time. When you were 20, this entire 3-step sequence happened in a fraction of a second, without you even thinking about it. But as we cross into our 50s, 60s, and beyond, a silent biological wear and tear takes place. And this is the part that traditional medicine rarely takes the time to explain to you. Those lightning-fast nerve pathways? They start to act like an old, degraded telephone grid. The signals from your brain become muffled, delayed, or lost entirely before they reach their destination. You might have the clear desire in your mind, but the physical message simply does not arrive on time. Then look at your blood vessels. After decades of fluctuating blood pressure, cortisol spikes, and natural aging, those vessels lose their youthful elasticity. They become rigid and restricted. It is exactly like trying to push a high-pressure rush of water through a rubber garden hose that has been left baking in the sun for years. It becomes stiff, narrow, and simply cannot accommodate the flow. And finally, the absolute most ignored part of male anatomy, your pelvic floor muscles. These are the physical structures responsible for holding and sustaining your erection. Just like your biceps or your chest, if you do not actively engage and train them, they suffer from severe atrophy. They become weak, lazy, and lose their mechanical grip. When you combine muffled nerve signals, rigid blood vessels, and a weakened muscular foundation, the result is exactly what you are experiencing: the fading of your automatic morning responses and a frustrating lack of reliability when it matters most. But here's the incredible news. The hardware is still there. Your engine is not dead. It is simply dormant. The wiring and the plumbing just need a direct, physical intervention to wake them back up. They need a biological jump start to bypass the slow pathways. And that is precisely what happens when you physically target the hidden control center we are going to discuss next.
If you want to reboot a frozen computer, you do not keep hopelessly pressing the keyboard. You go directly to the master reset button. Your physical anatomy has an exact biological equivalent to this reset switch. It is a highly sensitive, densely packed intersection of nerves and blood vessels that acts as the hidden control center for your entire reproductive system. In medical terms, this specific area is called the perineum. It is that small, unassuming patch of skin located directly between your scrotum and your back passage. For decades, men have completely ignored this area, treating it as nothing more than an anatomical bridge. But from a urological and structural standpoint, it is the absolute most critical piece of real estate in the male body for maintaining lifelong performance and vitality. To understand why this specific spot is so incredibly powerful, we have to look at what lies just millimeters beneath the surface. When you touch your perineum, you are not just touching empty skin. You are interacting directly with the gateway to your prostate gland. Right above this superficial layer sits a massive, intricate network of essential nerve clusters, specifically the branches of the pudendal nerve, and the main arterial highways that supply oxygen-rich, pressurized blood to your entire pelvic region. When you apply targeted physical pressure to this exact spot, something remarkable happens to your internal engineering. First, you are essentially providing a gentle, stimulating external massage directly to the prostate gland itself. This physical compression acts like a pump, helping to clear out stagnant cellular waste and accumulated fluids that often cause internal congestion and choke off healthy blood flow as we age. Second, and perhaps more importantly, you are sending a massive, high-voltage wake-up signal straight into your local nervous system. Remember those slow, muffled nerve pathways we talked about earlier? By stimulating the perineum, you are completely bypassing the brain's delayed signals. You are triggering a local, instantaneous reflex. It is exactly like jump-starting a dead car battery. You are mechanically forcing the local blood vessels to rapidly dilate, demanding that fresh blood rush into the tissues immediately. And the beauty of this mechanism is its simplicity. You are not undergoing any invasive, uncomfortable procedures. You are not introducing synthetic chemicals or expensive pills into your bloodstream. You are simply using safe, mechanical pressure from the outside to force a powerful biological reaction on the inside. By consciously manipulating this hidden control hub, you are literally reminding your dormant systems exactly how they are supposed to function, naturally restoring the automatic, powerful responses you thought were lost to time.
Let's strip away any awkwardness right now. I know that for the vast majority of men, intentionally focusing on and touching this specific area is completely uncharted territory. But remember, we are treating your body like a machine that needs maintenance. You would not feel embarrassed about massaging a cramped hamstring, and you should not feel any hesitation about physically engaging the most important vascular junction in your reproductive system. Finding your perineum is incredibly simple and completely straightforward, but precision is key. First, you need to be in a position where your pelvic floor is not under intense tension. The easiest way to do this is to sit comfortably at the very edge of a firm chair. Alternatively, and this is often the best method for beginners, you can do this lying flat on your back in bed, with your knees bent and your feet resting flat
On the mattress. This position naturally opens the pelvic region and completely relaxes the surrounding muscles. Once you are comfortable and relaxed, take your dominant hand. You are going to use your index and middle fingers together, keeping them straight and firm. Reach down and locate that soft stretch of skin situated exactly halfway between the base of your scrotum and your back passage. Gently press upward into that space. You are not looking for a hard bone, and you are not pressing into empty space. What you are feeling for is a distinct slight firmness just beneath the surface of the skin. It will feel almost like pressing your fingers into a dense muscular cushion or a tight rubber band. Once you feel that localized density, stop searching. You have found the exact target. That is your perineum. And directly underneath your fingertips lies your prostate and the critical nerve pathways we need to wake up.
Now, I need to prepare you for what you might feel the first time you do this. When you apply pressure to this spot, you will very likely feel that it is slightly tender, sensitive, or even mildly uncomfortable. Do not panic, and do not let that stop you. In fact, if it feels tender, that is actually a fantastic sign. That tenderness is the physical proof of everything we just talked about. It is the undeniable symptom of localized congestion. It means that for years, old cellular waste, stagnant fluids, and restricted blood flow have been trapped in that exact area without any physical release. It means your pelvic floor muscles are tight, cramped, and crying out for oxygen. That initial sensitivity is precisely why you need this massage. By locating this point, you have just found the roadblock. Now it is time to clear it. Now that you have successfully located the target, it is time to execute the protocol. This is not a random massage. This is a precise 60-second mechanical intervention designed to force blood flow and trigger your nervous system. I need you to follow these steps exactly, because technique is everything when it comes to maximizing your biological response. Step 1 is establishing the correct pressure. Take those two fingers, your index and middle finger, and press firmly into the perineum. I want you to think of this like pressing a doorbell that has gotten slightly stuck over the years. If you just graze the surface of the skin, absolutely nothing will happen. You must apply enough firm, steady pressure to actually engage the tissue beneath, but never press so hard that you cause yourself sharp pain. You are aiming for a deep, therapeutic pressure. Step 2 is the activation. Once you have established that firm pressure, do not just push in and hold. You need to create friction and heat to wake up the nerve endings. Begin moving your fingers in small, slow, deliberate circular motions. Start by making clockwise circles. I want you to maintain this continuous clockwise motion for exactly 30 seconds. As you do this, you might actually feel the tissue beginning to warm up under your fingertips. That is the physical sensation of localized blood flow rushing into the area, breaking up that stagnant cellular congestion. Step 3 is establishing balance. After your first 30 seconds, I want you to seamlessly reverse the motion. Switch to counterclockwise circles for the final 30 seconds, keeping that firm pressure absolutely consistent. But here is the secret that makes this entire protocol work, and it is the one step most men completely ignore. Step 4 is your breathing. If you are holding your breath or tensing your stomach while you do this, you are actively fighting the massage. Tension physically clenches the pelvic floor muscles, locking the blood out. While your fingers are doing the mechanical work, you must actively oxygenate your system. Inhale deeply through your nose for a count of 4. Hold it for 2 seconds, and exhale fully through your mouth for a count of 6. This specific breathing pattern acts as a neurological switch, forcing your central nervous system to relax the pelvic floor, opening the floodgates so the blood can finally rush in. 60 seconds of massage, deep, rhythmic breathing. That is the entire protocol. Let me be completely honest with you. If you treat this like a magic trick, doing it once and expecting to wake up the next day with the vitality of a 20-year-old, you are going to be disappointed. We are reversing years, sometimes decades, of vascular restriction and muscular atrophy. This is physical therapy for your reproductive system. It requires consistency. To rebuild that broken mind-body connection, I recommend performing this 60-second protocol exactly twice a day. Make it as automatic as brushing your teeth. Your first session should be right in the morning, ideally while you are still lying in bed and your body is naturally relaxed. This morning activation wakes up your entire pelvic region and gets healthy, oxygen-rich blood flowing for the day ahead. Your second session should be right before you go to sleep. This evening routine is crucial because it physically clears out the vascular congestion and inflammation that has built up from sitting or standing all day, promoting strong restorative circulation while you sleep. Additionally, you can utilize this massage about 15 to 20 minutes before sexual activity. That immediate, localized spike in blood flow can help you achieve a stronger, firmer physical response precisely when the moment arrives. But what should you actually expect to feel? Let's talk about the realistic timeline of your recovery. Within the first few days to a week, you are going to experience what we call the awakening phase. You will likely notice an increased sensation of warmth in your pelvic area and perhaps a subtle tingling throughout the day. This is a massive victory. It means the dormant nerves are firing again and the vascular rust is clearing out. During this first week, many of my patients report the first subtle signs of their morning firmness beginning to return. By weeks 2 and 3, you enter the restoration phase. This is where the magic happens. The morning responses become noticeably stronger and much more frequent. You will find that achieving firmness requires significantly less mental effort and physical assistance. The pathways are clearing, and the signals from your brain are finally reaching their destination without delay. By week 4 and beyond, if you have been consistent, many men experience what feels like a complete mechanical reset. Responses are firmer, they last longer, and they happen reliably. The sensitivity you thought was permanently dulled is suddenly heightened. Remember, every man's biology is different. If your circulation issues are severe, it might take you a bit longer to break through the congestion. The key is unrelenting patience and daily consistency. Your body desperately wants to heal and function properly. You just have to give it the daily mechanical signal to do so. Once you have mastered the basic 60-second protocol, and it feels like second nature, it is time to upgrade the routine to maximize your biological output. Think of these advanced biohacks as adding a turbocharger to an already functioning engine. First, let's talk about friction. To make this massage as comfortable and effective as possible, apply a single drop of a natural unscented oil, like organic coconut oil, to your fingertips before you begin. This eliminates surface friction, allowing your fingers to glide perfectly over the skin and transfer all of your physical pressure deep into the tissue where it actually matters, rather than just pulling on the surface. Second, we need to focus on structural reinforcement. I mentioned earlier that your pelvic floor muscles act like a valve to trap blood and maintain your firmness. To turn this simple massage into a full structural workout, You must combine it with Kegel exercises. Immediately after you finish your 60 seconds of circular pressure, I want you to perform 10 to 15 pelvic squeezes. How do you do that? Simply contract the exact same internal muscle you would use to stop the flow of urination midstream. Squeeze that muscle tight. Hold the contraction for 3 solid seconds and then release it completely. The massage forces the blood into the area, and the Kegels train the muscles to lock it there. It is the ultimate combination for lasting stamina. Third, take advantage of thermal vasodilation. Try performing your evening routine while taking a hot shower or a warm bath. The external heat naturally causes your blood vessels to expand and relaxes any residual tension in your pelvic floor. This makes the tissue far more receptive to the physical pressure of the massage, amplifying the rush of circulation. Now, before you begin any of this, we must have a serious conversation about medical safety. This is a powerful, localized intervention, and you must listen to your body. Never perform this massage if you are experiencing acute pain, severe inflammation, or if you have any open sores or infections in the pelvic region. If touching the perineum causes sharp, stabbing pain rather than just mild, congested tenderness, stop immediately and consult your physician. Furthermore, if you have been diagnosed with an enlarged prostate, severe prostatitis, or any active prostate condition, you must clear this with your urologist first. In the vast majority of cases, this massage is actually highly beneficial for prostate health, helping to clear stagnant fluids. But it must be medically appropriate for your specific condition. Finally, hear me clearly on this. This mechanical massage is a highly effective complement to your overall health routine, but it is not a substitute for professional medical care. If you are dealing with severe cardiovascular disease, uncontrolled diabetes, or complex nerve damage, you need a doctor managing your systemic health. We are optimizing your local hardware, but your overall engine still needs to be professionally maintained. Gentlemen, you do not have to quietly accept a decline in your vitality as just another inevitable part of getting older. Your body is incredibly resilient. Your vascular hardware and your nervous system still have an immense untapped capacity to heal, respond, and perform with power, provided you finally give them the correct mechanical stimulation to wake up. I am not asking you to buy an expensive supplement. I am not asking you to schedule an embarrassing clinical procedure. I am giving you a tool that is completely free, backed by thousands of years of traditional practice and modern urological science that you can execute in the total privacy of your own home. So, I am issuing you a direct challenge right now. Starting tonight, I challenge you to commit to this 60-second protocol, twice a day, once when you wake up and once before you go to sleep. Do it for the next 30 days. It will take exactly 2 minutes out of your entire day to potentially reclaim the confidence and automatic responses you thought were gone forever. If you are ready to stop accepting defeat and take control of your own biology, I want you to go down to the comments right now and type 3 words, I am in. Make that public commitment to yourself. And when you start feeling that warmth, that returning firmness, and that surge of morning vitality, I want you to come back to this exact video in a month and share your success story. Your comment could be the exact inspiration another man needs to take his life back. If this medical breakdown opened your eyes to how your body truly works, hit the like button so the algorithm shares this vital information with other men who are silently struggling. Subscribe to the channel and turn on notifications because I will be sharing even more advanced, science-backed protocols to biohack your longevity and performance. Take control of your hardware, stay consistent, and I will see you in the next video.